Hello everyone, my name is Dr. Shruti Sharma and I'm Program Manager of Physician Association for Nutrition. This is our 14th CME, and in Gujarat is the first time we are coming here, so Kem Cho. Okay, so before we start, this is our usual ritual that we always pay our respect to nature. So I would like to invite all of our ambassadors on the stage so that we can water the nature and start this ceremony. Doctor, please join us. Doctor, you also please come. Yeah, more ambassadors are here. Please come. We are meeting for the first time, so I don't remember them by face. One group photograph with our Gujarat ambassador. Dr. Shefali will take over from here for the agenda of the presentation, agenda of this seminar. Please take over.
Hi, good morning everyone. So, welcome to this PAN group, PAN family. I'm sure you're going to enjoy your time here. What we learn here is something that we've always known, but something that now comes through science. I have been given this job of taking you through the agenda or telling you what PAN is about and what it is doing here. So PAN India, our mission aims to be the catalyst in revolutionizing healthcare into a whole person care model with evidence-based nutrition at the core matrix. Our mission is to address the multitude of issues related to dietary choices of people in India by facilitating better healthcare systems, healthier and safer food environment, and public awareness. So this is the core team of PAN India. Dr. Alan Kornberg, who's the strategic advisor, PAN USA, Nicholas Oppenrider, who's the chairperson, Dr. Rajeena Shahin, who's here with us. She's the medical director, PAN India, and Shruti Sharma, who is here. She's the program manager. The way PAN engages this is the engagement model. They are in-person seminars. So they're awareness and network building seminars like the one we're having right now. We conduct in-person CMEs or seminars at medical institutions and organizations across India. And we've conducted numerous CMEs at medical colleges across India. Which I shall share in the subsequent slides. There are also online trainings, which include regular training programs online as the network of doctors come from various states. The online sessions include journal clubs, discussion forums, and Convo Connect. So this, as we know, that is the 14th CME. So these were the initial ones. One in Ames, Nagpur in April 23. And the dean and the team of faculty are now keen on conducting regular online training sessions at the campus. They already have a department of lifestyle intervention clinic and are handling patients. This is another one at BMCRI Bangalore, which happened in June 23. They have been numerous which have happened after this as well, and they are very, very well attended, all of them. So PAN trained 14 volunteers in the CME on plant-based nutrition from Jan 23. And the highlight of this event was a panel discussion where HODs participated in the discussion. The online training model consists of webinars, which we have pretty regularly. And they were once conducted by Dr. Ravi Mamtani, who's based, I think, in Qatar, and Dr. V. Mohan, whom we've all heard of, and other ones. We had a very nice one recently on diabetes, and the journal club here, which is a monthly journal club, and again, it includes physicians and food scientists, discussion forums, which again have meaningful conversations around EBM. EBN is evidence-based nutrition. And Convo Connect, wherein there are various WhatsApp groups, and there are discussions on numerous topics and sharing of a lot of research material and on various talks around plant-based nutrition. So how do we associate with PAN India? It is either through PAN EBN ambassadors who are practicing physicians or faculty to promote evidence-based nutrition. They could be PAN volunteers, medical students who can involve with various online and offline activities. They could be consultants, focus team. The team does various engagement activities. You could also join the medical student network. Like we were discussing, that we actually saw somebody, a young medical student here, which is so nice to see, because that actually is the age when you can groom and have people really following and see the complete benefits. And the physician network. So practicing doctors from various specialities are there on the email list, and we connect with them. Recently there was this meeting where the PAN national ambassadors got together. It was at Bangalore and last month, and it was amazing to see the energy levels there and the information transfer. This is the journal club team, which has Dr. Vivian Sindhura as the president, who's based at Hyderabad. And as you see, it is a team mix of people from all over, from different states who can contribute. And so there are a lot of activities that PAN has gotten into. They're actually getting together to write a book which would include about nutrition from various states in India, and how plant-based nutrition, which derives its intelligence also from the ancient Indian sciences, and how the traditional food also is helpful, and how we need to relook at our habits and make people aware as physicians, and doing only that much can really get us to better health versus the medicines, which is also necessary on this path to while we get it back to complete nutrition, plant-based diet. Discussion forum. So this is Dr. Nitesh Fasale, who's the president here. We have Dr. Yogita Bavaskar. Again, all these are very dynamic people when you meet them. This is the medical content team with Dr. Melinda as the president. There is EBN ambassadors from medical school, Dr. Mrunal Phatak, who's the academic dean at AIIMS Nagpur, heads it. There are EBN volunteers. So this is about, there are a lot of activities they are involved with. They're trying to reach out various the medical colleges and reach out to the public. So working on how they could do it best, because of so much research that has happened, that we will see in the day ahead as to how that actually helps get back our vitality and our health. Thank you. Yeah, I would invite Dr. Varsha to take on from here.
Good morning, everybody. So, on an early Sunday morning, we are going to talk a lot about evidence-based nutrition. Now, why the need for this evidence-based nutrition? My journey started in 2018 when I started learning about nutrition. And we'll just share as to what is the need and what is the awareness regarding plant-based nutrition and how effective it is. That will be discussed by the speakers thereafter. Now, what is a paradigm? Anyone? What is the meaning of the word paradigm? We have a paradigm shift in health, paradigm is something where a change that is brought about by certain actions, whether it is by the people or the environment, which is a massive change, and you can see that. When I studied, infectious diseases were the top causes of mortality. So, as you can see, in the 1990s, we still had infectious disease, neonatal mortality as the top causes of death, versus we have cardiovascular disease as the leading cause of death just now. So this is the major epidemiological shift or transition that has occurred over the last, say, from 1990 to 2000, 2010. So in 10 to 15 years, we have shifted from communicable diseases as the major cause of death to non-communicable diseases as the major cause of death. Now, as a practicing pediatrician, I am seeing non-communicable diseases in children as early as 10 years, 12 years, 15 years, means childhood diabetes type 2, hypertension, obesity, hyperlipidemias, which I did not see, say, before 2019 or 2018. So, what is causing this major shift? Now, this is the statistics, say, you have almost 75% of death across the globe attributable to non-communicable or lifestyle-related chronic disorders. So, this is the situation in Gujarat. This is, I think this is January 24. This was there in the headlines. Gujarat cardiac crisis at a record high. This was the 108 data which had come. Okay, so we have a maximum emergencies for cardiac related issues, whether it's coronary artery disease or whether it is hypertension related to converting to stroke. And Ahmedabad leads that. Of course, Ahmedabad is one of the largest cities of Gujarat. So we have a lot of cardiac emergencies in Gujarat. And the incidence is just increasing day by day. Along with this, we are the food capital of Gujarat. Okay, Gujaratis are foodies, they're very sweet, and we have sweetness in our food as well. By far we are vegetarians, but still we still have a lot of obesity, and obesity is the precursor for all chronic diseases, whether it is coronary artery disease, hypertension, hyperlipidemias, susceptibility to malignancies. So it is with the base inflammation, chronic inflammation being the root cause for all these lifestyle related disorders. So this was a statistic. Every third Ahmedabadi is obese. We'll come to that. Now, this is the rate of increase of obesity. It is as high as almost 124%. We've increased our obesity levels to such an extent. Now, what is driving this epidemic of obesity, diabetes, and coronary artery disease? This is the prevalence of diabetes in Gujarat. It's around 40%. Okay, so that high is the prevalence, and we are seeing this at earlier ages. Like I'm seeing college-going students with type 2 diabetes. I'm seeing hypertension in at the age of 19 years. And we're seeing a lot of autoimmune diseases as well at an earlier age. Recently, I saw a 12-year-old child suffering from multiple sclerosis. That's the youngest child with multiple sclerosis recorded in India. Now, this is the health snapshot of Ahmedabad. This is the incident. 34% of men, consuming tobacco, physical activity, coronary artery disease, dyslipidemias. What do you think is causing this major shift, or what do you attribute this change to? Now, this is the Global Burden of Disease study published in Lancet in 2017, which shows that across the world, that 20% of the underlying root cause is poor nutrition, which leads to chronic disorders or lifestyle-related disorders. Now, nutrition is, as the root cause, exceeds tobacco causing lung cancer or asbestos causing lung disease. It has beaten all other causes, and it's one of the most important root cause for all lifestyle-related disorders, which is the number one cause of mortality across the globe. So what is leading to this? This was published in the journal Circulation as changes in South Asian diet and health. We are moving away from our traditional diets to consuming more of fast food, junk food, more of added sugars, more of processed food, increased dairy products, increased refined grains, and increased sugar-sweetened beverages. So when you consume that to a larger extent, the healthier choices automatically drop off. So you have reduced consumption of whole grains, fruits, vegetables, legumes, beans, herbs, seeds, and nuts. So this South Asian gene, we are genetically also more prone to accumulate fat. So we have a greater percentage of body fat as compared to Caucasians, and that fat is stored in the viscera. You have fat stored in the liver causing fatty liver, fat in the pancreas leading to fat in the liver, pancreas, muscles, everywhere leading to chronic disorders. So that has less lean mass. We have less lean muscle mass because of our food intake also and because of our sedentary lifestyle also. So this is the WHO criteria, and we have a special column for Indians, Across the world, obesity is defined as a BMI of 30 or more, overweight above 25. But for Indians, obesity is over a BMI of 25. And even more than that, it's the waist circumference. If your waist circumference exceeds your hip circumference, you are obese even if your BMI is normal or even if your weight is normal. It is an indirect indicator of visceral fat. So this was the ICMR INDIAB study, which shows the prevalence of obesity. Generalized obesity is around 29%, and abdominal obesity is 40%. That high is the incidence of obesity. And look at the prevalence of dyslipidemia, 81.25%. Means almost 8 out of 10 have some form of dyslipidemia in our country. So why this is important? Because all this these are modifiable factors if we as physicians and nutritionists work on them and increase that awareness. When it comes from the horse's mouth, it is more likely that the patients will listen to it. We all know that fruits and vegetables are healthy, but we don't know how healthy they are. We all know that packaged food, junk food, fried food, and dairy is not good for health, but you really don't know how dangerous it is. So moderation sometimes does not work. Okay, and in my practice, I see a lot of processed food intakes amongst teenagers. So what happens is an obese teenager would go for a diet Coke or a diet soda. Why? Because it has 0 sugars, 0 fat, 0 saturated fat, and 0 salt. But what happens is, what is the sweetener in diet Coke? Anyone knows that? It's aspartame and acesulfame with phosphoric acid. So what does aspartame do? It is 200 times more sweeter than sugar. When you have a drop of that on your tongue, your body has a very beautiful mechanism. When you have something sweet on the tongue, your receptors send that signal to the brain that sugar is going to arrive. But because it's a 0-calorie sweetener, the body does not actually get any sugar, but insulin is still released. Now that insulin will reduce the blood sugar and it will cause hypoglycemia, so you will feel more hungry. So Diet Coke actually increases hunger, it increases weight, and in the long run it causes insulin resistance. So you know what the packaged food industry is giving you? Sweetness without sugar, creaminess or softness without fat, savoriness without salt and proteins. So what happens is, it dysregulates the hormonal balance in the body. When you add xanthan gum or guar gum as a fattening agent or artificial creamers and all, your body knows that the taste is of that fat, the hormones are released, but that fat actually is not received. So it is more dangerous to have processed foods. Okay. And that is what we are seeing, ready to eat foods, processed foods, very high in sodium, salt, sugar, fat. And we all have volunteered ourselves for an experiment without consent for new molecules, whether it's stabilizers, INS, emulsifiers, rising agents, anti-caking agents, anti-acidity agents, all those numbers that you see behind packages. These are molecules which are not tested like drugs, but they are experimented on the public. And in the long run, what they cause is dysbiosis of the gut microbiome, leading to chronic disorders. So I usually call processed food or junk food as industrially produced edible substances marketed for commerciogenic, profit-driven industry. It's basically, you never see an advertisement for an apple, but you will see advertisement for an apple juice. You never see an advertisement for a potato versus advertisement for potato chips. They are made so tasty that you just can't have one. You'll finish the whole packet, but you will still not be satiated. And the second is, in our state, we are by far a vegetarian state, but we still have a huge consumption of dairy. So that will come to later. Okay, so if we want to improve our patients' health, we have to change. That paradigm shift has to come in our practice as well. And to be perfect is to change often. Thank you. We'll have Dr. Rajeena here next.
Yeah, the small room, I thought it doesn't need a mic. Now it's almost full. Good to see. And the best part was we've been doing this CMEs across different states in India. First time in Ahmedabad. I was also skeptical first time coming here. You don't believe we were getting help from the shopkeeper to the drivers to the people who is in the shop. So my daughter, she came with me. She's saying that such a beautiful state with beautiful people, so helpful. Even person who is standing next to you at the shop, they're very helpful. Bringing you stuff and helping you with multiple things. So that's the best part of the city. We roamed around a bit to see, normally it's better to see the lifestyle habits and also the cultural heritage and stuff. And few of the places we went and we bought some stuff and we asked them what they are eating, what they are adding in those things actually, On a personal level, my eating habit is basically I don't eat any animal products including dairy. So it was very difficult for me to get something here. Okay, that is first thing. And the shops were all telling that they add a lot of ghee, because without ghee, if you sell, people won't buy it. Large quantities of ghee. Another thing what we observed is, yesterday my colleagues have gone out, myself, Dr. GR and Shruti and all, and each of the dishes which we ordered, what was it, a greenhouse restaurant or something, everything had sweets. So I was just, laughing when Dr. Varsha said that actually. And then that is one of the reasons why we as a country, every part of India, we have a dietary, I say that every 100 kilometers we have a new dietary pattern. But none of these dietary patterns are helping us to thrive. We are having diseases by 40. Even now, as she said, we are seeing young children, teenagers coming with the hypercholesteremia, type 2 diabetes and stuff. So we need to change this. To change this, we need to lead this. We need to have physician leaders leading this. The reason being, because the whole system is actually occupied by players from everywhere, from wellness players to social media entrepreneurs to influencers to the celebrities. So they are the ones really recommending people what to eat, which they don't know anything about science. They read something somewhere, they get some paid this thing. That's what is happening. We need to change this. That is why PAN kind of an organization is significant here. And for me, I've been doing this for the last 10 plus years, and under PAN, 2 years now. With ISLM, I think most of you guys have connected with me from ISLM. PCRM also, we have done something. Now it's high time that we take this forward with more and more physician leaders coming into the picture. And adding on to Dr. Shaifali's presentation, we do have multiple roles. So one of the top roles is medical advisory panel. So we have 2 advisory panelists here, Dr. GR. He is a cardiologist from PSG IMSR, and Dr. Sharang, he's an ophthalmologist from Mumbai. And then the next level, ambassadors, who will be working with national ambassadors, who will be working with us closely to bring these changes in their respective states and even country. And then we have local associates, ambassadors, patrons, different ways you can associate. And there are paid positions like part-time payment where you have seen multiple teams. So we are actually following a pattern of not having too many permanent employees, rather people who associate with us at various levels, so that this influence and this impact can be widespread. That's how we work with. And I think this part of it she has already mentioned. The idea is to bring in doctors, physician leaders to be involved in the food transformation really needed for changing the healthcare landscape of the country. Not only healthcare, you will see further presentations by Dr. Sharan how our eating pattern is also affecting our planetary health, climate change. So this a little bit detailed, this I've already mentioned. The first primary part of ours is training doctors just like this. This is our 6th CME for practicing doctors. We have done in Mumbai, Bangalore, Cochin, Hyderabad. Mumbai and Bangalore, we had 300 plus attendees. 80-85% of them were doctors. We also creating an ecosystem around this. So that had a larger number because it's larger city, and we also had started putting the effort at an early stage. And then the doctors involved with us create these tools and resources for other doctors to practice. And as I mentioned, we are also involved with ecosystem development here. Some of the questions, most of the places we get are, the vegetables and fruits basically are studded with pesticides. So what do you do? So in these kind of scenarios, it's not just the practice and prescription which helps. We also need to work with the industry players and policy makers. We already had multiple meetings with FSSAI on food policies and how we can be there in their panel of advisors to help them form better strategies, training their IAs and similar kind of people. So that's also going on one side. There are some public awareness programs which we do, and where we take the help of our ambassadors will be doing this. Research is another area we're just starting. This year we will have a smaller focus on research. We all know that we have a lot of data about evidence-based nutrition, primarily focusing on plant-based nutrition from the West. Anybody has data in India, large number of people. We do not have yet. We still need to create. So we are in the process. We will be starting those researches too. So multiple ways you can all associate with us. Be there in the group, associations group, AHM association. We will start the activities. Our ambassadors in the state will start activities. Learning engagement activities, and see whether we can come together, form some kind of surveys and studies and stuff. This actually is already obvious from Dr. Varsha's presentation. Why nutrition is important in the healthcare metrics. Anybody, younger crowd, please tell me, why did you guys come first place? Yeah. Why do you think nutrition should be at the core metrics of the healthcare system? There is a nutritionist always. Why it has to be at the core metrics is the doctor or the nurse, that system. Why is it important? Yes, please.
जैसा होगा अन्न वैसा होगा तन, मतलब what we eat makes us health. हमें कुछ भी work करना है, even if we are talking about physical level, workout, anything in the day-to-day life, what we eat makes us. That's why nutrition is something that needs to be taken care of very minutely.
Excellent, thank you. Anybody else? Why it has to be? Yeah, definitely nutrition is very important because it is what makes you who you are, right? So, but why it has to be inside the healthcare metrics? Yes, please.
Current medical practices there, we are generally treating diseases after they occur. But nutrition, exercise, the way we eat will lead to changes in the body, and it can prevent diseases from occurring in the first place then.
So preventive focus.
Yes.
Very good.
Second thing, as mentioned in the first session, gut biome exists, microbiome exists. See, if we take artificial sweeteners or artificial diet, it will change the gut microbiome, which recent studies have proved that it leads to chronic diseases, including mental illness and everything. Third thing, what we eat can change the nutritions, play an important role in the hormonal processes. So not taking proper nutrition can lead to hormonal imbalance, which can again lead to severe disorders. So everything, it ends with nutrition. The center point of every thing of the body lies with nutrition.
Perfect. Okay, so yes, please.
So till now date, what research has been done and all that, we have extended our lifespan but not health span, right?
Very good.
So that's the point. So whatever you are eating is not nutrition, whatever you're eating at home is not nutrition, but what you're eating from where, how it assimilated and how it is absorbed and how your body is taking. So it's a whole science and it is the core which gives you energy and
Excellent. Wow, what a wonderful, such a small crowd. This is the first time we are addressing small crowd, but very efficient. No stuff. Really, Ahmedabad.
Is going to influence 2 generations from now.
Epigenetics.
We are talking of epigenetics.
Excellent.
And every disease has a root in epigenetics. Most of
Perfect. I think I do not need to show these slides. It's all well answered actually. So this epidemiological transition, Dr. Varsha already mentioned, 72% global burden of health is due to NCDs, which requires nutrition, addressing nutrition. And it's 66% latest number, unofficial number in India. 62 was actually 2016. And so then when you look at the healthcare challenges, you can see that NCDs, communicable diseases, injuries and stuff. When you look at the other larger segment, other than NCDs, we have a newer set of challenges coming in. Anybody came across any diseases or calamities or anything related to climate change in any part of India? Recently, I think Eastern India have reported some heat-related stuff and flood-related stuff, right? So Dr. Sharang will be giving a lot more details. So we have another new set of challenges which is coming up because of the way we are treating our nature, climate, right? So that is another set of challenges. So when you look at it, as you all mentioned, the root cause of all the illnesses have nutrition as a larger component. And we are not addressing that. We haven't addressed that traditionally over the last 100 years, in spite of so much data coming in. Why we didn't address that? As doctors, at the apex of the healthcare system, we were not given enough tools and resources to address that. Any reason why? Okay, so we had a lot of data which was coming in nutrition, at least the last 30 years, but it was not incorporated into the nutrition, into the core of the healthcare system, or the doctors were not addressing it. We were always going for the pharmaceutical and procedures and stuff. Why it was not, there was no proper processes involved in incorporating nutrition into the healthcare system. Perfect. Yeah, we were all actually driven by the profit system, which is actually led by the pharmaceutical industry. And we didn't have anybody to support us to practice nutrition. Where practicing nutrition is not only going to help our patients or our practice, it is going to help ourselves, our families, our friends. So, and actually we were so ignorant, we were taking a huge privilege out of ourselves and also our patients actually, by not providing the right guidance about nutrition to our patients, right? Everybody believes, everybody, can you just raise your hands? Believe. Great. Okay. Yeah, this is already mentioned, the rapid globalization led to increase. Do you, what is the percentage of non-vegetarians, meat-eating people in Ahmedabad? Dr. Varsha, any idea? Yeah, it's very less actually. Compared to other states, it is less. But vegetarian statistics, if you take, India, we say that it's a vegetarian nation, but only 30% of the people are pure vegetarians. Rest are all actually. And coming to Ahmedabad, Rajasthan, other states, they are predominantly vegetarian nation. But we are still high on another animal products, which is again not good for us. What is that? Perfect. So in Jaipur, when we did the conference, we were just doing a survey. We, with the help of people, we called some of those families, and per person, they were consuming 5 servings of dairy a day, which is giving them some 32 grams of saturated fat. The upper limit should be 12 to 15 grams, right? That's the level at which we are going because we don't have knowledge. We never learned nutrition in detail. And yeah, this is very clear. All of you believe that we need to address the root cause. We are not addressing the root cause. We are addressing the risk factors once it starts happening, right? So we need to address that. So now we all believe that we need to make nutrition or lifestyle intervention as the primary line of management. And if it doesn't work, it doesn't work. See, we also can't be like stubborn, it has to work, plant-based nutrition will work. That's not the case always. 70-80% it works. So 30 maybe plus percentage doesn't work. As clinicians, we should know which patient it is working and which patient we should put him on medications or therapies. So that is why doctor's role is very important here, right? So that can only be done when you have that evidence-based approach to therapies. Otherwise, and one part of it, otherwise what we'll keep on doing the same thing. There is a leak tap, there's a beautiful picture which I always try to present, but we are not addressing the leak of the tap. We are trying to mop the floor with some mop because already issue has happened. We keep on doing it. The issue is still happening. Keep on doing it. I came across a patient, within 5 years, he was on 11 medications at 48 years on diabetes and metabolic syndrome. Just imagine actually, it just keep on happening because the major issue was not corrected. He was 106 kgs, 5'9" or 5, nothing is addressed. The doctor kept on giving medications, he was comfortable, he just have to pop the pill. And one of the major thing, even some of my colleagues, when initially we talk about nutrition, one of the major thing which we receive from them is it's totally confusing. It's unbelievably confusing. Why? Because every time they look into the paper, there is some new studies coming in. One study says that, oh yeah, vegetables and fruits are good and you need to reduce the saturated fat. The other study says that you need to be having enough fat and saturated fat in your diet, right? It's totally confusing, right, for a new person. So how do we overcome this? What is the solution for this? If you look at this, and nutrition confusion part is one part of it, there are a lot of fad diets. If you look at these fad diets, most of these are not done by doctors or the science bodies. It is done by somebody who has a bias on a keto diet or, similar kind of diets. It's not something which is done by science world, right? That is one of the reasons. Second part is actually nutrition is always not a linear equation. You eat well, you're not always that directly translate into health. There are multiple other confounding factors. When it all work together, you get perfect health. So, and also the nutrition, when you talk about food comes as a package, the package is what matters. So hence these things appear always confusing to us because we never learned the nuances of nutrition in college. So the solution is evidence-based nutrition, knowing and learning evidence-based of nutrition. And we know that you look at the graph, this graph was taken from Dr. Yeah, I think it was Mazzafarins. He's a cardiologist. He's a Tufts University nutrition head, and he's the one bringing a lot of changes in the US. So this is from Lancet. He mentioned. So it's like last 30 years, if you look at it, every decade it is doubling and tripling the number of studies coming in nutrition. And doctors, we call it like nutrition, doctors who are in the nutrition space, like nutrition and medicine space, we say that we will have 10-fold more data in the next maybe 4 or 5 years than what we had over the last 100 years. That's the way it is going. So much of money also going into the picture. Last year, it was reported that 44 billion USD was spent on nutrition. How many of you were involved in any of the researches? Anybody? Anybody? Where is it going? It's not coming to us. So we need to understand that our role is very important. We should demand, we should come forward, we should lead this. So evidence-based nutrition is basically best. We are using the best scientific evidence with all the studies, analyzing it, and then bringing our clinical experiences, patient values, and practice, help people to thrive, to help them live life to the fullest, not just living with some diseases every time, go to the hospital, get a stent done. I came across a patient, 4 times stent done, okay. I told, why don't we start changing a little bit? No, doc, I can't do all those things. I want to eat my mutton, this thing, that thing. That's the way because the way the industry has shaped their mind is that without taste, you are not living. You are not enjoying life. You are losing some major pleasure out of life. That's the way it has been. So evidence is similar. Just like our medical evidence-based medicine, the lowest thing is non-human studies, case control studies, case studies and stuff. And then highest is actually intervention studies, RCTs. RCTs are not always possible with nutrition. There are some reasons. It's very difficult. So one of the things which you all can look at is the systematic analysis, meta-analysis and systematic reviews. Many are there actually. Like for some of the things, one of the major things which I felt was very useful was 2018's American Heart Association's one meta-analysis which was done on all the saturated fat studies, because there was a huge controversy. Most of the cardiologists won't agree that saturated fat has to be reduced because there were a lot of controversy around it. Look at that study, that will make you understand how beautifully they have put together that. So that is something which we need to understand. What kind of studies we should be looking for. Not like some study suddenly comes and tells that intermittent fasting is not good because 92% risk. Where is the data? What kind of studies they have followed? Nothing is known to us, or it is not proper. And then comes to the guidelines. We all say that, okay, so much of guidelines, so much of studies have come, and the guidelines also is 80-70% correct. They're bringing the changes, but it is not reaching the public. What is reaching the public? If you are protein deficient, you need to take supplement. The guidelines, all the guidelines, if you look at it, it is from Eat Lancet to WPB Food Guide to Canadian Food Plate. You can see that half or more of the plate should be filled with vegetables and fruits. A plant-forward diet. And a part of it, grain portion. Some portion, Canadian Food Plate still includes some animal proteins. But look at the 90-80% or more, they are all aligning. But this is not going to the patient. But this is not going to the general public. What going is, this without eating animal proteins or a protein supplement, you are not having enough proteins in your food. Oh, this I've already mentioned. This is the whole area is occupied by players, unscientific. We need to take over. I really like your energy. You should come forward with us. Yeah, what's your name? Yes, please. I think you should join one of our teams. Thank you. All of you, actually, I really felt that energy in him, that vibrating, that please, all of you youngsters join our teams, actually, multiple teams are there. And so we need to really get into the field. And this is like a little science on that, why it is needed. We just not saying because we did some market analysis. This is again a study systematic review published in Crawley et al. I think 2019. It's a universal global thing. Nutrition is insufficiently incorporated into the clinical curriculum of ours. How many of you don't agree with this? Okay. Everybody agrees that we don't have enough nutrition in our curriculum, right? Yes. So because of that, we are not confident enough to what to say to our patients. That's a global one. It's a global phenomenon. That's why PAN is a global organization. It has 22 countries present, 11 countries operations like ours. And we also have done a survey, again a scientific, not purely scientific, semi-scientific survey. It also says the same thing. It's not incorporated into the curriculum. It's not practiced well. Dietary guidelines normally done by the nutritionist, though they are knowledgeable, their advice is not taken seriously. And also there is always only like 5 to 7% of the patient reaches the nutritionist. It is at the discretion of the treating physician or a cardiologist or a gynecologist to decide whether the patient has to go to the nutritionist. So naturally nutrition is not into the core of the stuff. And then it also says, yes, doc.
But more than just taking it as a part of the curriculum, because we are from yesteryears of our medical education, it's the whole attitude of how you see disease. It is seen as infective agent, diagnosis, and medications. If that is the viewpoint, your curriculum will always remain in that spectrum. I think what is really needed is the change in the way you look at disease and you look at the way a disease is treated. Then this will get into the curriculum.
Total agreement. That was the slide which was shown earlier. I didn't go much into the details. I thought we all knew this. This is how disease happens. There are distal causes, proximal causes, medial causes actually. We are looking at only the risk factor. We are not looking at the root cause of these illnesses. So lifestyle medicine that way is very important, and PAN's work is predominantly into the nutrition segment actually. So it's very important to look at diseases with a different angle. It's very important. What's your name, sir? Oh, you're Dr. Manja. Oh yeah. Okay. Okay, docs. Sorry, actually yesterday we couldn't meet. In total agreement. So, and also like the report says that as physicians, when we involve with these things, we have actually a much higher impact on the society, because we can actually share our tables with our policy makers, industry bodies, even guide the public. So the impact will be much higher, not just limiting to the patient. That's what the report said. The report was done in 2022. And nutrition, this is very important. Dr. Sharang as an advice and Dr. GR mentioned that this is very important for me to cover. Basically, what is plant-based nutrition? Because our primary mission is to propagate, to help create awareness about evidence-based nutrition, primarily focused on plant-based diet. Why plant-based diet is important? Anybody, what is plant-based diet? Okay. So this is actually Dr. Varsha. Yes. Yes, doctor. Yes, of course, please.
वो जो हमें प्राकृतिक रूप से मिलता है वही हमें यूज़ करना है, उसको उसमें कुछ चेंज नहीं करना है, नहीं कुक करना है, नहीं को और कुछ करना है, जैसे मिलता है वैसे ही हमको खाना है, वो प्लांट बेस्ड डाइट है.
Perfect. So basically it is whole, everything without much processing and much this thing. But that's what you meant. Yes. Thank you, doctor. Yes, that is very important. So again, little bit science about this. All these years research was going on. We have done extensively studies on the plant-based diet or plant-forward diet like Mediterranean, DASH diet, MIND diet, and which is plant-predominant diets. And this is one of the major study which can't be ignored, because it was done in 195 countries in 2017. Now it is 204. Large number of people. 15 dietary risk factors were identified. Look at the risk factors. High in sodium, high in trans fat, then look at the high in processed meat, red meat, and look at the lower ones actually. Lower ones is what Dr. GR always says that we should be focusing on, because we are not eating enough of fruits, vegetables, nuts, legumes, whole grains actually. That is putting us into a higher risk of developing disease. When we are not eating the right ones like vegetables, fruits, nuts, and what are we eating? We will see what we eat, what we are eating, or our generations are eating. So healthy eating patterns naturally should be low in sugar, salt, saturated fat, trans fat, should be high in micronutrients. Also we should take care of the short pile nutrients which normally comes in our diet, basically calcium, iron, zinc and stuff actually. So it's generally it is predominantly plant-based or plant-based diet with whole food predominance is very good, but we also should look at those shortfall nutrients occasionally to see whether some of these things are going to be deficient. Dietary pattern, your thing comes here. So anything which is whole, which is fruits, vegetables, whole grains, nuts, seeds, highly protective for our body, it is giving rise to another life, right? When you put a seed down, it actually giving rise to another plant actually. So it is very productive. And fish, yogurt, poultry, lean meat, butter, all these are actually high in saturated fat. Fish also has cholesterol and saturated fat, not as high as that, but it also comes with a lot of heavy metal poisoning. And also you will see with the Dr. Sharon's presentation, as human beings we should also be aware of what we are doing to our environment. So looking at these two factors, it's better we focus on the first part of it, which is fruits, vegetables, whole grains, legumes, nuts, seeds, and limit or completely avoid the ones which is lower. Completely avoidance is better if you're able to take care of all your nutrients by a proper planning and stuff. And if it is not, like slowly start changing it actually. How many of you eat 5 servings of dairy a day? Okay, I can see some numbers. No. Fruits and good fruits and vegetables. How many people eat 5 servings a day? Wonderful. Okay, I'm in love with Ahmedabad. We have less job to do. Yeah, great. Yeah, and then actually a lot of other things comes. This may not be very significant in the awareness session. Some of these areas like microbiome, gut health, intermittent fasting, phenolic compounds, and our anti-nutrients in legumes and stuff. Personalized nutrition, precision nutrition, food allergy, cancer, all these things are evolving. We do have enough and more data about NCDs, right? From our Framingham study onwards till here, we do have enough and more data, which Dr. GR will be talking in detail. But other areas are evolving. We still we need more data, but it's all promising. Whatever comes out, we can analyze and give it to the public so that they'll start incorporating these things. Indian diet, the best diet. Who believes the current Indian diet is the best diet in the world? You believe current Indian diet is the best diet? Yeah, that's what. If it is done properly, that's not happening. So, yes. So, we do have, if Indian diet was, there is no Indian standard Indian diet, first of all. America, we have they have a standard American diet. Europe, more or less the same. Yes, Doc.
Yes, we are forgetting our ancient literature.
Yes.
So, if we discuss, as you said, you have used the word that Indian doesn't have any standard diet. We are not following any of the scriptures. If we look at the Charak Samhita, Susrut Samhita, a day-wise, I can say what to eat in summer, what to eat in season-wise, everything is given. But what is the problem with us, including me, that we are amazed with what outside India other people says. We are not looking at our own literature. So if we look into it, it is full of each and everything is given, but we are not reading it, including me.
Exactly. So that's what I'm actually going to talk about. So we did have a great lifestyle pattern where our people actually, ancestors followed a very healthy lifestyle with fruits and vegetables, and people used to live, there was a history I read, people used to live 100 years, like the Gurujis and stuff, people and all. But now look at the kind of younger generation. By 40, they're all having diseases. So it's a mix actually, both. So we have multiple burden of diseases. One side of it, we have undernutrition. We have another side, obesity and other stuff, like which is 66%, and we do have hidden hunger. And one of the major reason, which is saying the Indian migration study says that higher energy consumption, salt, sugar, fat, and reduced level of physical activity. This is the reason. As he said, we incorporated a lot of changes over the years from West industrialization. That slide you must be remembering. So we've changed our diet and we still feel that is the best. It is not. We have changed our diet. Only 20% is our traditional diet, which was coming from our scriptures and other things. Look at Eat Lancet Commission, what it says. They also have done an analysis comparing the Lancet recommended diet with the Indian diet, and it says that we are only 40 to 50% of our recommended daily allowance of fruits and vegetables are met. We are over consuming our refined grains, like 70-80% of the grain, that too refined grain, is consumed in rural areas. And as I mentioned, when they are shifting this pattern, what they are putting in their plate is refined grains and also the packaged food. And the people who are following predominantly vegetarian regions, or a lot of dairy, which is ghee or butter based. And the people on the non-vegetarian side, 70% of the population, to meet their protein, they are eating a lot and lots of animal products. And I come across gym going guys who are eating, we have Dr. Ashwa here, he will be talking, and we will see like 250, 300 grams of chicken a day and 200 grams of paneer a day. Paneer and chicken, paneer actually 100 gram itself is 16 grams saturated fat, at least 14 to 16 grams saturated fat. So we are not aware. And as you mentioned, that's what is happening. One side of it, the packaged food and Western food industry. Other side, our own regular consumption of dairy has gone up. It is 4 times now. And the meat, we have a huge appetite for meat right now. It is like doubled in the last, or more than doubled, almost tripled in the last 2 decades or 3 decades. And then plant-based diet. Plant-based diet is basically, this I don't want to focus a lot on. We will have more discussions around this. It is something which is more into vegetables, fruits, whole grains, legumes, nuts and seeds. Nil animal products is ideal, and some animal products while you do the transition. Traditionally, we have used Mediterranean diet to DASH diet to MIND diet. Scientific world have used as plant-based diet, but now vegan, vegetarian, a lot of these diets are coming. But ensure that you're following a whole food, plant predominant eating pattern, which is, as doctor said, without minimally processed one. And all animal products exclusion ideal. I know that people who are quite used to dairy, it takes time, but start making the shift. We all did the shift. I come from a non-vegetarian background where my husband eats a lot of non-veg. Now he has also come down. Me and my daughter, I think she's here, 5 years back, we completely shifted. No animal products at home at all. So it's not something impossible, it's very much possible. And I feel that I feel much more energetic, exceptional, except sometimes, than in my 30s. 40s, I really have an exuberance of energy. I completely give this to the ecosystem, all this ecosystem plus the food I consume. I'm not highly into physical activity. I kind of meet like maybe 30, 45 minutes. That's what I see in my practice. Other than this, I do have a practice which is called Invest on Health, which caters to people. We see people change over 6 months. They become something else, totally different, with energy, doing like somebody with 110 kgs doing a triathlon or doing some marathons and stuff. They're like actually challenging their own potential. So there is huge potential in plant-based diet. We need to start doing it. Start not completely eliminating in the first place. Start reducing your dairy consumption or the processed food and start creating healthier plates. It has huge significance. These are the science of it. You will come to know in detail about these sciences at a later stage, where a lot of data is there. Have any of you watched the documentary called You Are What You Eat? Younger? Yes, one person. I think you guys should watch some of these documentaries, which is very important. What You Eat is actually based on a study which was done in Stanford under Dr. Christopher Gardner, one of the top nutrition scientists, unbiased scientists in the world. You should watch that actually. It's again a Blue Zone documentary is there about Blue Zones. Blue Zones, anybody knows what is Blue Zone? Okay, at least so many, yeah. Good, ma'am, yeah. Excellent. Very good. Yes, so that those are the areas. So their dietary patterns were analyzed. They all follow a plant-predominant eating pattern. From there it started, and you can also see all these studies which came like long-term observational studies like Adventist study, nurses study, healthcare professional study, healthcare professional follow-up study. If you look at these are all not like small numbers. It's in lakhs and lakhs of people with credible data because they are doing it with healthcare professionals. You can see that everything is suggesting a plant-based eating pattern, plant-predominant eating pattern. And biochemistry, if you look at it, a plant-based, whole food plant-based eating pattern is automatically devoid of saturated fat, trans fats, sugar, salt, right? And it is also high in fiber and phytonutrients. So naturally, if you're not like stuffing your plate with just refined grains, even whole grains, stuffing your plate with adequate grain, and a lot of vegetables and fruits are included, legumes are included, you're going to have with respect to the nutrition aspect, you're going to enjoy an optimal health, right? And transitioning to plant-based diet not only is beneficial for human health, it also is beneficial for climate, biodiversity and stuff. This is again from Lancet, I think. It reduces the land use, greenhouse gas emissions, which Dr. Sharang will be dealing in detail. So what are we going to do? Once we practice, once each one of you start incorporating a whole food plant-predominant eating pattern, plant-based eating pattern to your lifestyle, you are actually going to get healthier. You're going to start losing some weight. You're going to have a better system happening, anti-inflammatory system start developing, anti-inflammatory state happens, and your health get better, your family's health get better, you start practicing, your patients' health better. Some of you will join us as ambassadors and patrons and others. They will start disseminating this information to the public. And look at maybe like 5, 7, maybe 10 years, you can see that 70-80% of India is going to follow a whole food plant predominant eating pattern. Indirectly, it will help us as a nation, we thrive, and we also contribute largely to our climate issues. That's what the message is, right? Okay, so let's all do it. How many of you are ready to make that transition, slow transition? What about the others? Not yet ready. Great. Anyway, at least 50% of the people are making the transition. So please be there in the group. Our people can help you to make that transition so that we all get healthier. We pass the same information to our public. Thank you. Thank you so much.